emergency medical system, or EMS, is a coordinated response of professionally trained people equipped with the appropriate tools to provide excellent pre-hospital care, transport, and further treatment upon arrival at a hospital, emergency department, or specialty care center. The success of our EMS system begins with the community. It is crucial for all of us to know how to perform hands-only CPR, basic first aid, register for 911 announcements, and to have a family emergency plan. In other words, be personally prepared. The EMS division is part of the County of San Luis Obispo's Public Health Department and serves a population of 276,443 people and covers a land area of 3,298.6 square miles. In San Luis Obispo County, there are 816 certified emergency medical technicians, or EMTs, 184 accredited paramedics, or medics, 83 authorized mobile intensive care nurses, or MICNs.
In my position as an EMT, we're first responders for 911 type emergencies. So if someone picks up the phone, calls 911, we're going to be the first people that show up on their doorstep. And so our role is to provide on-scene emergency medical care and basic scene management alongside with fire or police services and render care on scene and eventually transfer patients to definitive care, being the hospital.
I'm a firefighter paramedic with the City of Paso Robles, and our role is we respond to all medicals along with the ambulance. And we do everything that the ambulance paramedics can do, except for we just don't transport. So we can start lines, we can give all the medications, and we act as a paramedic on a fire engine rather than an ambulance.
Local resources include 8 dispatch centers, or public safety answering points, 11 fire departments, providing both basic life support and advanced life support, 2 ground ambulance transport providers, and 2 EMS aircraft.
Dispatcher is the public's first point of contact for emergency services. They will quickly ascertain the type of emergency being reported, determine where the emergency is taking place, the location, and then they will dispatch the types of services that are needed.
In addition, there are 4 base hospital emergency departments, 1 STEMI, or cardiac specialty center, and 1 level 3 trauma center. The EMS system is supported by a number of advisory committees. A vital component to the system's success and continued evolution is dependent on having citizen board member representation on our Emergency Medical Care Committee, an advisory body to the EMS agency.
One of the issues about being a volunteer on this and being a non-professional medical person was to understand the intensity that these people study and practice to bring all of their personnel up to high levels, I think in most cases surpassing anything the state requires. This is a group of people that work together very, very intently to try and give the best services possible for any emergency that comes up.